I didn't really feel the impact of medication adherence until I took more of an interest in the medications that my mom was taking. She's at high cardiovascular risk and she needs to be on medication every day. Recently, she had told me that she hadn't taken her meds in over a month because she had read that it was bad for her liver. The fact that she did this without consulting anybody was a really scary experience for me as their daughter. But as a healthcare student, it made me really see the impact and the gap between what we expect patients to know and what they actually know.
As a medical student, we're trained in really hypothetical patient situations for the first 2 years at least. So a really common clinical vignette we'll get is a patient with a serious condition that only takes her medication when she feels that she needs it, or only fills the prescription when she has the money. And once I got to seeing real patients, I realized that this wasn't an exaggeration. This was a very common circumstance that a lot of patients were in. And so it can be really tempting to just kind of lecture patients and tell them, you have to take this medication until your doctor tells you not to. But it's so important to get on that patient's level and, maybe ask them kind of what their life is like, maybe why aren't they taking the medication, involving a family member or a caregiver to have them make the patient accountable for taking the medication, or even just explaining to the patient, what disease they have and why they need this medication. Those are all ways that we can help improve medical adherence.
As dental students, you never think that medication adherence is an issue because you don't prescribe as many medications as pharmacists or doctors do, but we actually prescribe medications after procedures such as oral surgery procedures, such as antibiotics or narcotics, and we often see that infections aren't resolving after an extraction because patients aren't finishing their antibiotic course. And not only is the site more prone to infection, antibiotic resistance can occur. And in fact, we often see the opposite, where patients take more than the recommended dose of their antibiotic course. And we know that if they, for instance, when they think that they're getting an infection, or if they want an infection to heal faster, they'll take more than one pill, which we often know is not the case. And this is even a greater issue for when we prescribe narcotics for pain management because of the rising opioid-related deaths in the country. So obviously misuse and unnecessary use of medications can lead to adverse outcomes. And to prevent these things from happening, it really starts with patient education.
As students, it's easy to forget what we learn in the classroom and how to apply it into a real-world setting. The goal of medication adherence isn't to give you, a patient, a strict guideline to follow. What we really want to do is work together with you as the patient to understand the importance of taking your medications correctly.
Don't be afraid to ask what the benefits are versus the risks of taking your medication. We encourage you to ask questions. Some questions you can ask your healthcare team are, this medication I'm taking, is this hurting my kidneys? Is this damaging to my liver? If you're taking several medications, ask your healthcare team if there are any interactions between them. Ultimately, we're here to help you understand your disease as a whole and not just in the forms of your medication.
Whether it's side effects, cost, or ways to remembering to take your medications on a daily basis, we are here to help. Some questions you may ask your healthcare providers are, what if I miss a dose? Are there other treatment options available? Or if you're taking multiple medications, if there's any combination pills you may take. We are here to listen to all of your concerns.
You may experience difficulty remembering to take your medications on time, or think they're not worth taking because of any potential side effects you may get from the medication. We're here to tell you that you should explore your other options. Reach out to your healthcare team to find out if there's another treatment plan available that would work better for you. It's a far better alternative than to stopping medication altogether, as that can lead to further disease progression, increased economic burden on you, and the development of other diseases.
From medicine to dental to pharmacy, here at Temple University and across the country, we are here to say it is really about you.